Dr. Serjienko, good of you to talk with me this morning. I have some questions about long-term perspective. What are we looking at here over the long term with this COVID pandemic
Yeah,
and Mariposa?
great question. And how do we move forward? How do we transition from what's a pandemic into an endemic? And so a pandemic is where you're seeing worldwide impact from a novel virus, a new infection. And we've been at this for about 19 months now. And as I told the board, as I told the community back in February of 2020, that we were looking at 18 months to 2 years to move through the pandemic phase. And I think that still holds true. So at some point in time, and there's no clear delineator of, hey, today is going to be the end of the pandemic. It's where we start seeing fewer hospitalizations, fewer deaths with each successive wave of infections, where we see ourselves no longer going into surge because of those cases, where we're seeing healthcare resources being outstripped by demand. That's when we make that transition from pandemic into endemic. And how rapidly that happens basically happens because of the number of people who either are infected or have vaccination and have a relatively good level of immunity. So the more people that are immune, the less likely there is to be transmission, the less likely there is to be that surge again or an increasing wave.
How does that play out in an environment where this disease is constantly evolving, different variants?
Right, and so as we've mentioned before, the Delta variant is the variant that's most active right now, and vaccinations work against that. And we know that if you were infected recently, that you've got fairly good immunity to that. What we don't know is people that were infected in the distant past meaning a year and a half ago, what their level of immune response will be. But we do know that people who have a recent infection or people who have had the 2 shots plus a booster have a robust immune response and are again less likely to get infected and less likely to transmit the disease. So as we look at Mariposa County, about half of our population, maybe a little bit more if we include those people with natural infections, so say about 60% of our population have some level of an immune response. And so that will slow down transmission, but we'll see, based upon that 60%, some more waves. How many? I don't know. When? I don't know. But at some point in time in the next, say, going out to 24 months would be March, that we'll see fewer and fewer cases, and then we transition from pandemic to endemic. And to think of an endemic disease, think about influenza. Every year we have increasing cases over the winter months as people go indoors, as transmission becomes more likely in an indoor setting. And so the likely way forward with the COVID virus over the next 2 to 10 years is it transitions from a pandemic disease to an endemic disease. And people will become infected with it still. They will likely still get hospitalized with it if they're not vaccinated. And we'll likely have people who will die from it. But it'll be in smaller numbers and in numbers that will not strain our healthcare system. So that's sort of the transition from pandemic to endemic. What we really don't know is what happens after about that 10-year time frame. We know that this, what's called the beta coronavirus, will over time have less impact because it has the greatest impact on people who are older and with at-risk conditions. And with the younger you are, the less likely it is, even though you can still be hospitalized, still die from it, but less likely for kids to get really sick with it. So will this beta coronavirus end up like other beta coronaviruses, wherein you'll get infected with it early on, when you're 1, when you're 2, when you're 5 years old, and by the time you are really in an at-risk population, you've actually got a fairly healthy immune response to it. We know this is the case with 2 other coronaviruses that have been around for we don't know how long, but at least for decades, and can sort of do some sleuthing about what happened back in 1880, 1881. We think that's when one of those coronaviruses arose. So that may be the natural course of this. On the other hand, could we get other variants that create a more severe disease? And if that were to happen, then we would have to look at other vaccines or modifying the current vaccines. We'd have to look at other treatments, things that we would layer on. Would we have to go back to more masking, more social distancing? Always possible, but it's hard to say. What we can say for the next, again, coming up on the 2-year mark, probably that transition from pandemic to endemic. And then over the 2 to 10-year mark, looking at how does endemic go from causing decreasing impact over time to where it becomes a childhood disease that doesn't cause significant symptoms.
There's another dimension to this, and the long-term impact.
Yes, yeah. So when we talk about people who have had COVID and long-haul symptoms, is we know about 10%, maybe even more, of our population that were infected with COVID have symptoms that have lasted out for months. And even looking at, again, the infection's been around for 18 months, people who have had chronic symptoms, even though they've totally cleared the virus from their body, that those symptoms continue out for a year and a half. And so the question is what will the burden of disease be in terms of chronic or long-haul COVID on our population, whether that's respiratory problems, whether that is behavioral or psychiatric problems, because we actually are learning more about that, about kidney function, about all of the places that the COVID virus causes inflammation. Anywhere that inflammation arises, you can have long-term symptoms based upon that initial infection, even though you do no longer have the virus in your body. So again, a real unknown where people who have been infected are out of work. They're in their 30s, they're in their 40s, they're on home oxygen. When will those people get back to normal? If at ever, and those are things that we don't know, but we need to be mindful of, and we need to do that longitudinal study or survey and see where people go with the long-term disease.
Any advice right now that you want to share with us in the long haul?
Yeah.
We're dealing with disruption at a level that is historic. And there's another dimension to this that I kind of have been thinking about lately, and that is the stress syndrome of constantly dealing with COVID, wildfire, all the things that life has brought us back here in Mariposa.
Yeah. So I think what we have to keep in mind is that a pandemic is an unusual occurrence. I would have this to say, I've had 3 occur in my lifetime. This being the most significant, sort of a 1 in 100. So if we look back to 1918, 1920, and sort of what happened a century ago, same sort of things, economic stressors, behavioral health stressors, and yet over time we came out of that. Just like the disease itself will go from pandemic to endemic, we'll modify our behaviors, we will change, and hopefully come out of it stronger. And that's the optimism that I like to keep. The other thing I like to keep in mind is I've never thought about the pandemic in terms of fear, but rather in terms of what's called operational risk management. That is, what are the risks are we willing to take to maintain society? And we've seen that there have been secondary and tertiary impacts of the pandemic, whether it's like you mentioned, behavioral health issues or economic and the supply chain. We saw that our modern system is built around just-in-time. The problem with the just-in-time system, that creates an inelastic transportation system. And that inelasticity, when it contracted during the pandemic, wasn't able to re-expand as we move from pandemic into endemic.
Collateral damage.
Yeah, second and third order effects. And we kind of knew about those, or I knew about them as a potential when we started this because of doing pandemic planning. So not really surprising for me. But again, other countries have looked at this and realized the more successful they are at mitigating the impacts of the disease in the present time, the more rapid their recovery in terms of economy will be. So when you ask what are the takeaway messages, is doing those basic preventive measures to reduce the burden of disease will help us recover our economy more quickly. And so that means do those things that we've been talking about for the last 18 months to reduce disease transmission. Doing those same things will also allow us to get back to the new normal, because we won't go back to what we used to be 18 months ago. But it will allow us to access behavioral health services, allow us to stabilize the economy. So all those things are important. And then the last thing I think about is this isn't going to be our last pandemic. The reason that we have novel viruses coming out is because as we expand as the human race, we move into new environments, we move into new jungles, we move into new caves, we move into new territory. Every one of those places have new viruses. And when we move into those, whether it's the rainforest in Brazil or the caves in China or a river in Uganda, is that we're going to find new infectious stuff. That stuff will infect us, and then the question will be is how rapidly it will impact the rest of the world. You think about Ebola. I was never worried about Ebola in the United States because it causes such a level of sickness that people stop and they die right there. Conversely, we always worry about what's the next respiratory illness, what's the next flu, what's the next coronavirus, MERS, SARS, H1N1. All of those had potential. All of them created a threat. SARS-CoV-2, COVID, has created that threat. So we need to be prepared for the next one, and that means having that public health infrastructure, having that trust between public health and the community. All those things need to be in place to help us mitigate the impacts of the next pandemic. Because it'll be, don't know when. Could be next week, could be 10 years, could be 20 years, could be 100 years.
Thank you for your time. We'll be talking more.
All right, thank you so much.